May I request Dr. Titiyal sir for sharing his experiences of presbyopic phakic lenses.
Thank you. Good morning, friends. Thank you, Purin, for getting me into this wonderful course. I thought I'll share my experience with presbyopic phakic IOLs, which you all understand. We have a large range of people who requires presbyopic correction, and that is a very significant number. And it's going to be a future challenge for all of us to manage these patients. And almost 1.8 billion people globally are presbyopic. You can understand what a huge market we have, and nothing concrete till yet which can be a good solution for these patients also. These are various surgical options for tackling presbyopia in this age group, and I'm going to talk about presbyopic phakic IOLs, because this is one concept we have taken up from the ICL star, which has been there for more than 2 decades. And subsequently, so many ICLs or phakic IOLs have done such a good result for a myopic patient, hyperopic patient in a younger group. So I thought let's try these in a group of patients with a presbyopic. We have two lenses available, one from Star Evo Viva, which is EDOF ICL, and one is IPCL, which I've been using for the last 6-7 years, a hybrid hydrophilic acrylic refractive diffractive design like this, and which gives you a large range of correction from plus 15 to minus 30 diopters, huge cylindrical correction. And most importantly, you can customize the diameter 6.6 to 7.5 millimeter depending on the pupil size. Because pupil is one dimension which makes a difference in all these phakic IOLs. With the overall diameter range can also be changed. So you can really customize these lenses, and it also has a center opening which also decreases the intraocular pressure related changes also. You require a good, you can say, pre-op investigations like you do for all phakic IOLs. Same thing is here. And predictable bolt is again same, 250 to 750 microns after surgery. Make sure patient is, good counseling has been done, because that is one thing which is required for all refractive surgery. And this is required more for a presbyopic patient as such. Let me just show you one of the surgery here. This is a toric IPCL presbyopic lens being done. You have to have a good marking done. Axis is normally 180 degree for these cases. I normally use viscoelastic for these cases, and my preferred choice has been a sodium hyaluronate 1%. And this loading of lens, you should always read the instruction from the company how to put these lenses, because the angulation has to be different. Normally I take, these two holes which are there should be towards your right hand side if you are doing a right eye surgery, towards the left hand side if you are doing a left eye surgery. So once you put it there, it's an open cartridge. Make sure lens is free, because otherwise it gets stuck into the cartridge and you can break the lens. And you can inject the lens subsequently, very like you do for any other lens. It opens very slowly. Make sure these two holes are towards the lid side. That's the right configuration. If that is not happening, you can pull out the lens at that time only. And surgery is very, very simple. You can fix the lens in a toric area, remove the viscoelastic completely from the anterior side. And this hole gives you access for aspiration of viscoelastic also. Overall advantage, you all know phakic IOL is, this is the surgery which retains the patient's accommodation. Therefore, the age group which is suitable is from 45 to around 58, which is a suitable age group for a presbyopic implantation or IPCL. It's a reversible procedure, 40 to 60, ACD more than 3. This is a routine things. Pre-op work is similar as we do for all these things. The addition required for is a minus 0.5 diopter to the spectacle correction for presbyopic correction which patient requires. To just give you an example, one of my patient, 43-year-old male patient, minus 6. All high refractive error patients are good candidates. Never do for a low myopic patients, and emmetropic patients have a difficult choice. Hyperopics are always suitable cases. So this is the ACD of 3.2 millimeter and OCT. The corneal profile is absolutely normal, and if you look into the value of DLI, which is also normal in this case, 10, and DLI is normally I do for all cases, which is very, very effective way to counsel your patient. Lens is absolutely clear. You can see the point sort function is also very good, and this patient did well. This is a second patient where you can see the DLI is decreased. You can see 2.65. But this is not a suitable pace for patient for a presbyopic IPCL. In fact, any intraocular surgery. This case may be suitable for a presbyopic cataract surgery, where you can use presbyopic IOL as such. So this is a 3-year results of my cases with a very good outcome for uncorrected distance acuity, intermediate and near vision in all these cases, very effective lens. The only problem can be around 5 to 10% of my series of cases do complain of halos and glare and a difficulty night driving sometimes. So that has to be explained to these patients as such. This is one of the long-term results published in literature where they looked into a concept of a presbyopic IPCL, 6-month follow-up. My follow-up is now 6 years. The cataract formation can be there in these cases. Like this, one of my patients developed cataract, and the cataract can be tackled very effectively also. So this was 1 month after the IPCL. Everything was all right. And this is subsequently the patient came later after 1 year. You can see raised internal aberration for this patient because of cataract formation. And surgery could be done very effectively also. You can explant this lens and do a surgery through a 2.2 millimeter because this lens can come out from 2.2 millimeter. I could do Rexus and implanted multifocal lens for this patient subsequently, and patient did very well. You can see multifocal lens 6, 6, and 6. So this is the advantage of surgeons who are practicing this. You can induce cataract and do surgery subsequently and double from these patients. But counseling has to be done very effectively. The chance of cataract formation in my series has been around 1% in 3 years. To summarize, presbyopic phakic IOLs are a good option if patient is willing for this intraocular surgery and gives a very acceptable distance, intermediate, near vision for these patients. The only consideration is, if the pupillary shape changes, then the patient can have a difficulty of glare and halos. If your pupil is normal size, the patient is quite comfortable as such. Little bit of contrast changes can be there that can be managed by increasing the reading light for these patients also. But long-term results has to be seen, what happens to your patient after 5, 10 years, because they are going to come to age where cataract formation is going to be there. If you have a myopic patient, the SS has a nuclear sclerosis, which may get enhanced by this procedure. So that has to be explained to this patient. If you have access to eye trace type of device, do a serial DLI, and that will give you indication if surgery for cataract is required or not required. Thank you for your kind listening. These are our books. You can go through them. Thank you.